Okay, let's dive in. Cast your mind back to early 2020. Remember that feeling?
Oh,
The world was changing fast, and we were all scrambling for information about COVID-19, often from behind closed doors. It was a truly wild time for how we consumed news.
absolutely. With lockdowns and isolation, the internet and social media became not just a source, but, well, often the source of information for so many people.
Replacing traditional channels almost overnight.
Pretty much, yeah.
And that rapid shift led to something quickly dubbed the infodemic.
Hmm.
It was this overwhelming flood of information, a mix of the accurate, the inaccurate, the helpful, and the truly harmful.
Right. And while the concept of infodemiology, studying information patterns in a health crisis, it's been around for nearly 2 decades.
Okay.
But COVID-19 was really the first social media infodemic on such a, well, global scale.
For this deep dive, we're zooming in on a specific corner of that global experience.
Okay.
We're looking at an academic study that explored how social media impacted panic in Iraqi Kurdistan during those first few critical months of 2020.
Oh, interesting.
We found this particular paper fascinating because it offers a perspective from a non-Western setting, which, hasn't been as heavily documented.
Exactly. Our mission today is really to unpack the key findings from this study, to understand the specific relationship they found between social media use, the spread of panic, and the reported effects on mental health in this region.
And we're sticking strictly to what the researchers found and reported.
That's the plan.
So let's set the scene just a bit more. Early 2020, COVID-19 is spreading, lockdowns are happening,
Yeah.
and everyone is turning online for answers.
Yes. And this study wanted to measure the impact of that sudden reliance on social media, specifically in a region where this phenomenon hadn't been widely studied before.
But how do they do it?
They conducted an online questionnaire, translated it into Kurdish, and surveyed 516 social media users in Iraqi Kurdistan.
Okay, so it's a quantitative survey method, relying on what participants reported about their own experiences and feelings.
Precisely. It's self-reported data from people who chose to participate. And, the lockdown itself meant data collection methods were limited.
Sure, that makes sense.
The researchers noted these constraints, but they concluded their sample size was appropriate and the questionnaire itself was a reliable tool for gathering this kind of information.
Got it. So, armed with that data, what was the core finding? What did they conclude about social media's role?
Their main conclusion was pretty clear, actually. Participants reported that social media had a significant impact on spreading fear and panic related to the COVID-19 outbreak in Iraqi Kurdistan.
Significant impact. That's a strong phrase. Did they quantify just how significant that impact was in their data?
They did. The study identified a significant positive statistical correlation between self-reported social media use and the spread of panic relating to COVID-19.
A positive correlation, meaning more social media use tracked with more panic.
Exactly. They reported the correlation coefficient, the R value, at 0.8701.
R equals 0.8701. Okay, for you listening, an R value tells you the strength and direction of a linear relationship between two variables. A value of 1 would be a perfect positive correlation,
Right.
meaning as one variable goes up, the other goes up perfectly. 0 means no correlation. So 0.8701 is, well, it's a very strong positive correlation.
It is. Very strong. And the researchers went further to explain what that means in terms of the variance.
Okay.
Their analysis indicated that 75.7% of the variation in reported panic levels in their sample was linked to social media use.
Wait, hold on. 75.7%.
Yeah.
Almost 3/4 of the variation in panic is statistically linked to social media use in this specific study.
Wow. It is a striking number.
That really puts the scale of the impact into perspective. I mean, I wouldn't have guessed the correlation would be that strong. It suggests social media was maybe the primary driver of the panic levels they observed.
That's certainly what the study's finding points to, based on their data, yes.
Right.
They also noted this had a potential negative influence on people's mental health and psychological well-being.
Right, the mental health aspect. And how did participants report this fear manifesting? Was it physical, psychological?
The most common reported impact of fear was psychological. That was cited by 38.6% of those who reported feeling fear.
Okay, primarily psychological.
Yeah. Smaller numbers mentioned physical effects. Some mentioned a combination of physical and psychological or just physical effects. But importantly, the study also notes that 36% reported not being afraid.
Okay, so while a significant portion felt fear tied to social media and that fear was primarily psychological, it wasn't universal.
Correct.
Let's dig into the specifics then. Who was most affected and what kind of content was driving this fear?
Okay. So when they looked at platform use for COVID-19 information, Facebook was overwhelmingly dominant in this region. Yeah, 82.6% of participants used it for news. Other platforms like Instagram, Twitter, YouTube, they were used far less frequently for this specific purpose.
That lines up with Facebook's global reach, I suppose, but it's notable how much it dwarfed other sources in this context for this kind of info.
It really did.
And which group was most impacted psychologically?
The study found that the majority of youth aged 18 to 35 years were facing psychological anxiety.
Ah, the younger adults.
Yes, this group made up the largest portion of their participants overall, about 65%. And specifically, 40.2% within that 18-35 age range reported psychological fear.
So the youngest adults surveyed, who are typically, heavy social media users anyway.
Right.
They were disproportionately experiencing psychological fear linked to this information flood. Did they see differences based on other factors like gender or education?
Yes, they do note that the nature of social media panic varied somewhat depending on individual factors, gender, age, education level. Well, they presented some data showing differences in how different demographics use certain platforms for information and also how they responded to questions about fear. It suggests the experience wasn't, uniform across the board.
Okay. So beyond who was affected and where they were getting the information, mainly Facebook, what about the what? What kind of information showed on social media had the most impact on creating panic, according to the participants?
Right. This is a key insight from the study. The top category participants identified as most impactful in causing panic was, perhaps predictably, fake news about COVID-19.
Fake news, okay.
Cited by 26.6%.
Fake news being the biggest driver.
Mm-hmm.
That feels, unfortunately, expected in an infodemic situation.
Mm-hmm.
But what else? Beyond the outright lies, what were people pointing to as causing panic?
This is where it gets really interesting and maybe less obvious. Following fake news, the dissemination of the number of infections was the next most impactful category. That was 17.4%.
Just the number of cases.
Yeah. And then the number of deaths at 7.6%. Participants also mentioned just generally fear-inducing information and photos or videos of affected areas.
Wow. So it wasn't just misinformation or disinformation.
No.
Even the constant bombardment and the way in which factual statistics like case numbers and death counts were shared on social media contributed significantly to the panic reported by these participants.
Exactly.
That's a crucial nuance, isn't it? How presenting real data in a certain way, or maybe just an overwhelming volume,
Yes.
can still fuel intense fear.
It really highlights the challenge of information itself in a crisis, not just disinformation.
Let's step back then and look at the broader implications the authors discussed based on these findings. They noted something interesting about official sources.
Yes, they pointed out that people in Iraqi Kurdistan seem to rely on social media instead of using the official Kurdistan Regional Government, or KRG, webpage for information.
Why was that? Did they speculate?
They suggest this indicates that official governmental information sources had potentially eroded in terms of public trust. Or perhaps they just weren't effectively reaching people where they were spending their time online, on social media.
And that would create a significant vacuum, right? If you're not getting or trusting official information.
You're much more vulnerable.
You're much more vulnerable to whatever else is flooding your feed.
Precisely. Without a trusted or easily accessible official source, the study suggests people were less equipped to discern true information from false.
Which just fueled more panic and rumors about the true nature of the epidemic.
Exactly. And the authors make a pretty stark point based on this.
What's that?
They suggest the panic caused by this widespread social media information might have been worse than the actual number of COVID-19 cases in the region at the time.
Worse than the virus itself?
In terms of its impact, yes.
Yeah.
They proposed it could have a longer-lasting effect on the population's psychological well-being.
That's a heavy conclusion. Framing the information crisis itself, the infodemic, as potentially more damaging than the immediate health crisis, at least in terms of its psychological footprint.
It is. It really underscores the power of information or misinformation in these situations.
So, based on all this, what recommendations did the authors offer? What do they think needs to happen moving forward?
Well, their core recommendations really revolve around the need for education.
Education? How so?
They stress educating media consumers on how to identify reliable information and how to practice critical thinking online.
So basically bolstering digital literacy as a public health measure.
Essentially, yes.
Yeah.
That's a good way to put it. They also emphasize the importance of collaboration during crises,
Collaboration between who?
bringing together health professionals, media experts, and involving ministries like health and education before the next crisis hits, kind of building preparedness.
Proactive, not reactive.
Exactly. And a specific suggestion was for universities to play a role in educating young people. Remember, they were the heaviest users and significantly impacted in this study on how to effectively search for and evaluate health information online.
That makes a lot of sense. And the paper touches on this being a global issue too, right? Citing examples elsewhere.
Right. They briefly mentioned reports of similar misinformation challenges in other countries, like China and India. They also cite a European Union document alleging Russian disinformation campaigns during that period.
So it wasn't just happening in Kurdistan.
Definitely not. But they also contrast the negative findings with examples like Vietnam, where the Ministry of Health apparently successfully used social media for public health messaging, showing that the platforms themselves aren't inherently bad, maybe, but their use and the content need very careful management, especially in a crisis.
Okay, so to wrap up this deep dive then, this study in Iraqi Kurdistan gives us specific, quantified evidence that during the early COVID-19 infodemic, social media wasn't just a source of information.
The no is primary.
It was the primary source for many. But it also played a significant role, according to the study, in spreading panic and impacting mental health, particularly among younger adults.
Yes, and crucially, the study highlights that this panic wasn't only driven by outright fake news, but also significantly by the volume and presentation of even factual data, like case numbers and deaths.
It offers a regional snapshot of a global problem, really, underscoring the real-world psychological consequences of the infodemic. Despite its limitations, as a self-reported survey conducted under difficult conditions.
Which leaves us with a pretty big question to ponder, doesn't it?
Exactly. Here's something for you, the listener, to think about. Given that even seemingly neutral or factual information like case numbers contributed to panic alongside fake news in this study, how can individuals, social media platforms, and public authorities work together before the next health crisis hits? How do we ensure that necessary, potentially life-saving information can be shared effectively without inadvertently fueling levels of fear that might become, more disabling than the health threat itself?
It's a really complex challenge.
It is. It goes way beyond just identifying fake news, clearly. A lot to think about there.